Hi, everyone. Great to see so many people here today. Thanks so much for joining us. My name is Claire Barrington. I'm a fellow here at CGC and a faculty member in the Department of Health Behavior. And it's my sincere pleasure to introduce my colleague, Dr. Natalicio Serrano, who is our speaker for the seminar this week. Nat joined the Department of Health Behavior as an assistant professor just a few months ago in the fall of 2023. I'm going to just give a brief background and then let Nat take it away. Nat completed all of his training within the field of public health, which I actually did as well. So it was fun to learn that about you, with a BA in public health and an MPH in health promotion and behavioral science from San Diego State University. See some love back there. And most recently a PhD in public health sciences from the Brown School at Washington University in 2021. Dr. Serrano's dissertation was titled Exploring the Differences in Modern Policy Strategies, Physical Activity, and Displacement. And prior to coming to UNC, she was a postdoctoral fellow at the University of Illinois Chicago's Institute for Health Research. So you can see the health and policy coming through pretty clearly. To that end, Nat conducts research to inform equitable and sustainable policy to promote physical activity and chronic disease prevention. He is already a member of PAA, though not the PAA that many of us are affiliated with, but rather the Physical Activity Alliance, which is an advocacy organization dedicated to promoting access to physical activity. In his current research, Dr. Serrano uses systems science and an intersectional approach to understand and address issues related to neighborhood development, racial and economic segregation, gentrification, and displacement. He's already a well-established scholar in this field with 17 publications and many others on the way. He's a selected finalist for the RWJ Health Equity Scholars for Action program for a study on the impacts of neighborhood development and physical activity in Latinx and Black communities. Welcome to CPC, Dr. Serrano, and I will let you take it from here.
I had a whole introduction slide for myself. Like, I'll probably just fast forward that. You know, you've given such a well-rounded intro. But thanks y'all for having me. I'm actually, I am always excited to talk about my work, but it hasn't been a great amount of lectures that I've given to the UNC community. So this is a way to sort of introduce myself, but also introduce this set of research that I'm really excited about moving forward. And so just to go into it, because I often ramble and go on tangents, so I want to make sure we stay to the time. And I do want to note that if you do have like very immediate questions of clarification and things like that, you can definitely ask. But if they can wait till the end, that'd be appreciated as well. But today we'll talk about some of my research on equitable and sustainable strategies for active living. And what this presentation is really going to do is explore the impacts of neighborhood development and zoning strategies for active living specifically, but I think for public health and overall quality of life as well. So I like to acknowledge folks right at the beginning. I think this slide tends to go towards the end of presentations, but the fact is these collaborators and partners are vital for the work I have done and will be doing. One person I specifically want to point out is Jamie Shrieky, who's at University of Illinois Chicago. A lot of this work wouldn't be able to be done without her. So definitely a shout out to her. Some of the funding that has paved the way for a lot of the work I've done. And also, Claire, you mentioned the Physical Activity Alliance, but another group I really want to point out, and maybe some of you are already aware of, but the Physical Activity Policy and Research and Evaluation Network. They do a lot of good work with physical activity related policy, but also healthy living, healthy environment policy. We delve into issues of, like I've talked about, gentrification and displacement, but also housing, food insecurity. So if you haven't been aware of it, now you are, and feel free to join and be a member. So I'll spend a little less time than I originally planned talking about my journey. I think it's always good to have an understanding of someone's background, but also, consider the perspective they're bringing in and the potential biases. So I always like to throw that out there. Background and context for sort of the importance of physical activity overall, but healthy environments. And then I have two main areas of my work I want to talk about. The first is really looking at the potential for neighborhood development and zoning strategies for active living. And the second piece is really starting to delve in to some research that I've looked at that looks at this need for equity-centered approaches. And of course, the ending is, why does this work even matter? And what's the future? What do I hope to do here at UNC? So to quickly go through my background and training, I always like to point out that I'm from San Diego, California, and I stayed at San Diego State University for my bachelor's and PhD. But I also want to point out that there is where I really gained some experience and training related to behavioral interventions, behavioral programming, and really got a good practice with community engaged and community-based work. And what that looked like for chronic disease prevention, but also physical activity promotion. In specific to San Diego was Latina communities. But then when I did my doctoral training in Missouri, I started working with rural communities. So that's the importance of context when we're dealing with different communities that I feel can be important to promote different public health strategies, but also these policies I'll talk about. Then I did some policy and implementation science work at WashU in St. Louis. And that really sort of funneled into my postdoc experience where I really dug deep into policy evaluation, but also I wouldn't call myself an expert in this field, but legal epidemiology. And I think it's always good to note that I'm happy to be here and very excited to be a part of the Department of Health Behavior and also affiliated with the Lineberger Cancer Center. It's funny, I'm probably like halfway through my first year. And I think this question has been coming up more often. Are you happy with the decision you made? And I wanted to mainly put this slide up because I am. So some background and context. Sorry, I sent my slides very last minute, so there were some transitions with, I think, font issues, but I think you'll get the gist of what these slides are highlighting. I think one important aspect of my work is physical activity promotion, and I consider myself to be a physical activity researcher. And this is, if you aren't aware of the field of physical activity, I like to put up this slide because I think it highlights well in one figure the public health implications of physical activity. I think most research and most folks' awareness of this topic is the connection to weight status, and from there, the connection to several chronic diseases. But I also like to think of the implications for quality of life. So higher physical activity is related to healthy aging, but also in the immediate term, there's these implications for sleep, better sleep quality, less anxiety, and reduced blood pressure. Also aspects that are very much related to quality of life. So I like to point those aspects out and let people know that beyond, I think the connection is always with having obesity, but beyond that, really wide implications for physical activity. And like other health behaviors and outcomes, there's these multi-level correlates or levels of influence that are connected to physical activity. Obviously, traditionally in public health and health behavior research, we tend to focus on the individual and interpersonal levels. But I like to consider all these levels and specifically environment policy. And one of the aspects that I really wanted to point out in this slide is, the solution for increasing physical activity levels or, improving public health overall isn't going to come within public health or health behavior. It comes from different sectors and disciplines. And a big part where you can see that is thinking about the regional or national policy influences. These levels of influence specific to policy are across sectors of transportation, urban planning, education, and I like to think of social work, community development, and housing as different sectors. So when we're considering these, I don't want to call it an issue, but like public health or health promotion, problem necessarily does the issue or solution to the issue doesn't come from within, it comes from this whole system. So this big topic I'll sort of talk about today, I think can be summed up in one slide. So there's this strategy that the Community Preventive Services Task Force recommends for built environment approaches that combine improved transportation systems with changes in land use and design. And I did want to note that that can mean large scale projects. So, Chapel Hill area is about to have the bus rapid transit system. Light rail lines are things we like to think about. But this review actually found that small scale projects also have a lot of influence. So thinking about just having bus shelters, improved sidewalks when we're thinking about community design and street connectivity, to the large scale side of those things like mixed use development. The one caveat is these changes usually work better when they're combined. So just having public transportation system options or just having changes in the land use or community design don't necessarily work separate, but together they have good implications for physical activity behaviors. This slide is interesting to me because it's already a lot of words to read, but I didn't put a slide for this, but I really thought about talking about the historic policies of zoning and housing policies that have led to some inequities in infrastructure and obviously segregation issues and really, talking about structural racism here. But I think the important thing to take away from that, and this is talking about redlining and policies that perpetuated redlining to not only bring about segregation, but bring about the poor infrastructure that came with that. But even to nowadays, we're seeing that those issues have had huge health implications, but also environmental implications related to health. So this slide is specific to active living, but this goes beyond that. So I did want to note that. But we are seeing, and these are very recent studies that came out. They're studies I wanted to highlight because I think they were really interesting when I read them. But racially and economically segregated neighborhoods may lack infrastructure that is supportive of physical activity or actually inhibits physical activity. So going down the list, those neighborhoods have more dilapidated buildings, less green space, less tree canopy coverage, lower access to urban rail systems, and in some cases, lower walkability. On the flip side, if we try to change up the script, zoning policy can have positive implications. So if we think about traditional or Euclidean zoning, that's the type of zoning where we're essentially just saying what the use of an area can be. So residential versus commercial. Zoning code reform establishes more guidance of how areas can be used. And this has really brought about an emphasis on reduced sprawl, creating more traditional neighborhoods that are walkable, increasing street connectivity, opening space, and having alternative transportation options. So really bringing about more public transportation systems. And I like to put this slide up because one of the topics of my work has dealt with gentrification and displacement. So I like to remind folks that if we're not considering the communities or the neighbors, the residents that we want to do this work for, there that even if residents are able to see that in itself can have negative health implications. So always important to consider. And this is sort of a slide where I wanted to leave off of when we're talking about the background and context of my work. It's been a great guiding framework for honestly the past 10 years of my work. And I say that because it is very broad and it isn't my conceptual modeling or framework, but it's the guiding framework for why I do what I do. I started off knowing that behavioral change interventions do have positive implications, and even environment policy strategies do have those positive implications, but real life activities don't operate in these silos that researchers tend to study things in. The truth is there's a whole system at play. So it's always important to consider these different sectors or disciplines when we have these strategies that, are beneficial, and we have shown there's a lot of evidence for the benefits of different behavioral interventions for physical activity, environment policy, that work is established. But there hasn't been a lot of consideration for these other sectors. And specific to my work, it's a lot of transportation, urban planning, housing, community development. But even outside of that, when we're not sort of having a good understanding of what our community members go through with the residents, or whatever community you're studying is going through, then I think at the end of the day, what you're doing is not sustainable. And I also want to know this figure, was something put together by a career mentor of mine, Dr. Bill Cole, who sadly passed away in the last few weeks. So I think it's important to think about like the legacy and the mentors you've had. So just wanted to know. So one big area of my current work is this potential for neighborhood development and zoning strategies to be beneficial for physical activity. Specifically for some communities that we might care, I don't want to say more about, but have historically had inequities. So we may want to do a little more work. Another example over my slides got thrown off a little bit, but I'll be talking about one specific study that was just published pretty recently, where we looked at zoning and in this study that was led by one of my collaborators, Dr. Jamie Schmidt, there was a collection back in 2010, and now we recently did a follow-up in 2020. And this was a huge study where we collected zoning ordinances from the first round of collection was 75% of the US population, and in the second round, 55%. So some might not consider it nationally representative, but I think it actually says a lot about the US. The one caveat is we tended to collect from the most populous US cities and municipalities. So if you have interest in rural communities, that data might not be. So I do like to throw that out and sort of let that be known as well. But we collected ordinances on, just looking at whether these zoning ordinances had zoning code reform. Beyond that, what type of code reform they had. So, there's transit-oriented development, there's smart form. I don't want to get too much into the details. The main thought you should keep from this is that this code reform is beneficial for physical activity and is connected to then creating better infrastructure for physical activity and activity. More recently, in the 2020 data collection, we got more measures surrounding equity, so exclusionary zoning, provisions related to affordable housing measures and the zoning ordinances. Hoping to moving forward, I don't speak a lot about it today, but moving forward, the hope is to look and dig a little deeper into those as well. So the current study examined the association between having pedestrian-oriented zoning provisions in zoning codes or ordinances and the connection with actual active travel and public transit use. And this is looked at by racialized segregation, which I'll talk about with the actual measures. But I think this next slide. So one of the major measures we looked at was just having zoning code reform or not. And then we created the zoning scale score specific to active living of these 8 pedestrian-oriented zoning provisions. So you'll see like all of these sidewalks, crosswalks, bike pedestrian connectivity, street connectivity, bike lanes, bike parking, bike pedestrian trails and paths, and mixed-use development. There's a large body of evidence that already shows those associations with physical activity. So the goal was to look at whether like having these addressed in the actual zoning ordinances was also connected to physical activity. And then to have a minor policy lag, we looked at community survey data at the municipal level. These are 5-year estimates. So a measure we constructed, and this was, we did a little research into this, and so how can we get at racialized economic segregation, which is what we went with at this municipal level. And we found this measure called the Index of Concentration at Food Streams, which you can look at those separately. So you can look at racial or economic segregation, or you can look at racialized economic segregation based off of densities of percentages of whatever population. So in the like just broad case, folks tend to look at family household income values of those at the poverty level, but also those considered high income. And the percentage breakdown is usually 80% or higher. And then for race, we did want to look at differences between Latina or Black communities, but for the purpose of sort of showcasing this data at a national level, we looked at non-Hispanic white versus. And the outcomes of interest, these are proxies for overall active living, but proportion of workers using active travel and proportion of workers using public transit. And these might be the sort of population level contributors, and also walkability, which is, there's huge evidence for that connection to physical activity. So we want to. So based off of the distribution of the data, we used correctional regression models, and this is used for portions or prevalences of alcohol. And we use tested moderation to look at the interaction between I'm going to go through these tables a little quickly because I think sometimes statistical numbers can be hard to digest. And I did put together charts that make it a little more interpretable, especially when we're talking about municipal level and adjusted prevalence estimates. I think it's better to just showcase what y'all can take away from this. But the thought of table one is this is the connection between municipal level racialized economic segregation with active travel and public transit use. And this is without having zoning code reform. So we see there is a negative association there. But I will say that's the case for most quintiles aside from the most privileged quintile. So when we look at this ICE measure of racialized economic segregation, the best way to interpret it is quintile 1 would be the most deprived or most segregated versus quintile 5 would be the most privileged. However, when we bring in zoning code reform, only the most deprived quintiles have a significant positive association with public transit use and active travel use for the two most. Now looking at that sort of zoning scale score that looked at those, remember the 8 pedestrian-oriented zoning provisions, sidewalks, street connectivity, bike trails and paths, all those things that significantly related to physical activity. Sort of the same thing happening without those. We see this negative association, but that's by most quintiles except for the most privileged quintile. However, when we bring in those zoning provisions, we then see a positive association for the most privileged. And that's for both public transit use and overall active travel. Interestingly, there's a significant relationship the opposite way for the most privileged. So when we bring in those zoning, that zoning scale score, which looks at pedestrian-oriented zoning provisions, we actually see a negative association with more privileged. So just to make it a little more easy to understand, these you can think about percentages at the municipal level of active travel to work. So this is not separating that by public transit use. This is overall active travel to work. So that can include public transit use. So we see that going from the more deprived quintile to the more privileged quintile. There's sort of this pattern of the more privileged the quintile or municipality is, the higher levels of active travel to work there are. And this is without zoning code reform. So the orange bar would be without zoning code reform. The green bar would be when we bring that in. But just thinking about the overall pattern, you can see this sort of rise by privilege of the municipality and active travel use. But there's an interesting difference of with and without, where like the more deprived quintiles actually benefit from zoning code reform versus statistically, it sort of looks like there's also the case for the more privileged quintiles, but statistically, that relationship isn't there. And if you're thinking, well, these numbers are low, what is 4 to 6%? When we're thinking about population level estimates, that's actually a good percentage increase. And the same can be said when we're looking at the zoning scale score that looks at those 8 pedestrian-oriented zoning provisions. So there is this statistically significant increase in percentage of folks in the municipality conducting active travel to work. Sort of actually around the same estimates. So for quintiles 1 and 2, which are the more deprived quintiles, there's a jump from 4 to 6%, and then from about 4 to almost 8% for the second most deprived. So I don't think a negligible increase to look at, and has actual implications for physical activity and overall public health. There's a lot of evidence out there for the implications of zoning for overall physical activity levels, overall active travel, and in some cases, the relationship with chronic disease. But I think this is one of the first studies that shows that zoning code reform can have positive implications for inequitable distributions, specific right now to active travel work, but even for overall physical activity. That being said, I think a lot needs to be looked at the actual implementation process for zoning and neighborhood development in these communities. Which leads me to the next area of research, which is this need for equity-centered approaches. So we do see zoning code reform, pedestrian-oriented zoning in these ordinances can have positive implications for physical activity. The caveat is that was cross-sectional. That was a cross-sectional analysis. And the next step was to look at it longitudinally. And this is, I went from like having this slide in to not having the slide in. It's something we're working on right now. The analysis is done though, so I felt comfortable presenting it. Fact of the matter is that I think structural racism in some forms does still exist. And I think that's the case with zoning code reform. And what we found that was when we looked at different measures, racial, economic, or racial and economic segregation, and we used that measure I talked about, the index of concentration at the extremes. We also brought in this other measure that's been used widely in public health, which is the index of dissimilarity. And what we found was that, you know, there were significant differences in implementing zoning code reform or pedestrian-oriented zoning provisions by racial segregation. Not the actually income didn't seem to matter, economic-based segregation, but specifically racial segregation mattered. So those municipalities actually were less likely to get zoning code reform established. So, you know, even thinking about historic policies, I think there's been a lot of interest in this topic. You know, what are the implications of historic redline and housing policies, and what does that mean for today? And I think there's this good movement of trying to have health equity centered in neighborhood development and zoning. But I think this highlights that we're not. One important aspect of my work is understanding how community members feel, but also other key stakeholders. This was a nationally representative study where we surveyed homeowners in the US to look at the perceptions of, you know, positive neighborhood development for active living specifically, and what were their concerns or support for that with regards to higher costs of living. And so these were the specific measures I looked at with what I'll talk about today. But the gist is that we surveyed them based off of, you know, even if they knew these changes might bring in a higher cost of living, did they still support it? And we also did still look at the level of concerns for whether those were brought up. And the sort of theme that came up is their support. So over half of respondents either supportive or weren't sure of whether they like the idea of bringing positive neighborhood development. The caveat of that is they still had concerns. And this is concern broken down by different forms of neighborhood development that we looked at. But the only idea I want you to take away from this is that they had concern for these things coming in despite supporting it. So that what that shows me is, okay, we want these positive built environment or infrastructure improvements to come into neighborhoods, but we have to have preventative measures in place to, you know, think about issues of displacement or gentrification, because that's really where the concern is coming from. You know, higher cost of living means, can we afford to live here? Can we afford to buy groceries and stuff? You know, you have to have other considerations versus, well, I do want these things to happen in our neighborhood, but I don't want to have to move. So a next step for me was looking at this issue with actual public health practitioners and community and advocacy organizations that worked on issues of active living, housing, and other public health issues at the neighborhood level. And what I saw was there was the shared belief that yes, neighborhood development and these changes do build healthier neighborhoods and improve quality of life. And we do want these to happen for our communities. But the fear is displacement occurring, and not only that, displacement occurring to these communities, thinking about persons of color or persons of lower income that already have several inequities when we're thinking about like public health overall. So the conversations that led to, well, what can we actually do about this? And a lot of what was brought up was about, well, we need equitable community engagement. We need, when these developers are coming in, or even if we're the ones implementing these strategies, we need folks in the room. And that's great, but the conversation then led to, well, we need to do more beyond that. The truth is, these developers don't want to do equitable community engagement. Another interesting fact, and this is before I did the zoning work, but zoning was actually brought up as a policy that could help with this. But one of the big things, and this was more true for practitioners, but they didn't know what to do about gentrification or displacement. They knew that, just because these things might be occurring to certain communities, didn't necessarily mean they didn't want to put in these strategies or policies that could be beneficial to the overall community. So they actually wanted more education and tools on the matter because they didn't feel that that was realized for a public health audience or people working in that field. And this ended up being coincidental, but during that time, I led a study partnered with the CDC, where we're actually putting together a list of anti-displacement strategies. So that list is available, and this is intended for a more public health audience to help inform those decisions. And there were themes that were brought up, a lot of them centered around preserving residents and making neighborhoods more inclusive so that they'll be able to stay. But interestingly, I was able to share this with the folks I interviewed not that long after. So I thought that was, a good example of, our work should help inform the work we want to do moving forward, and it should always matter. And I felt like this was hopefully one of more examples moving forward, but a good example of where I was like, oh, okay, this is going to actually be beneficial for folks. So I think we should always leave off on why does this all matter? Of course, it matters to me, and I tried to tell somewhat of a story with some of the work I do, but I wanted y'all to take some notes on why it matters to me to y'all. So this provides evidence for the importance of zoning and neighborhood development strategies for physical activity, but I think overall public health. And it can work at some of those inequities that I talked about during some of my slides. The goal is to have these environments or communities that are supportive of physical activity, but honestly healthy living overall. And I think zoning is a key strategy that can help inform those positive implications. But that being said, I think a lot of work is needed to explore the implementation process of some of these strategies because we are still seeing those inequities. That's really getting back on that slide of structural racism still occurring, specific to zoning code reform. So we really, if we want to have these benefits realized in the populations that might need them most, this equitable engagement and implementation needs to be centered in work. So where is this all going to lead for myself specifically? I'm already starting to look at other things outside of physical activity. So thinking about more social and economic outcomes. Housing is of particular interest to me, and also this joint issue of food insecurity and housing insecurity. The RWJF grant is actually hopefully going to fund the second piece of utilizing system science, specifically participatory system dynamics, to really gain a better understanding of the system. The thought being that I'd like to have a better understanding of policy levers or mechanisms to be able to prevent displacement or gentrification in Black and Latina communities specifically, since I've sort of seen that that's where the issue is growing and occurring. And the end goal is to really look at this longitudinally, look at this as a place-based intervention, and look at the differences of bringing in these strategies for different groups, and it's like long term. Also testing some of those anti-displacement and gentrification strategies. Yeah, that's some of my work. I really appreciate y'all listening. And I think if you have any questions, that was a great time.
Um, I'm sure you're aware of this literature, but so there's work in sort of sociology and other stuff about segregation that also shows not just for the lack of green spaces, but I was just thinking about this for the physical activity, hotspots. So the different types of cover, which meant it's literally 10 degrees hotter in Harlem than it is in the Village, for instance, in New York City. Like it's so much warmer. And again, as another level of stuff like that. So just there's a lot. It's more of a comment than a question. It just there's a lot of things that come into it about the work that you're doing that it place influences your physical activities. Yeah.
Yeah, and I think also what you touched on is the patients change.
Yeah.
So that intersection is really interesting. And I haven't made that a whole part of my work, but more into that, specifically heatscaping, which is what, yeah, really interesting.
I have a question about the results you showed on for the most privileged quintile where their active travel declined. I think, was that the right interpretation? Was that?
Yeah, and I guess I would say it was lower because it wasn't causal at all. So.
Okay, yeah, so, but I guess
Yeah.
if you were to like what would be going on there?
Yeah, so
Mechanism.
that's a good question. And I think there's a couple mechanisms at play. When you're in that more privileged quintile, I think you can self-select into neighborhoods. And a lot of times, these municipalities that are at higher cost of living, those folks might not care that they have these characteristics in their neighborhood that are beneficial for physical activity or having better public transit use. It's just that those neighborhoods can be, and I'm actually thinking local right now at Chapel Hill and Carborough. Those are the places people want to live. And if you're living in this midi area, that's at least, I've lived here for half a year. So but I don't want to speak for everyone here, but like, that's what I've gathered. But that doesn't necessarily mean that you're utilizing those characteristics. The other thing that I think is interesting, and this is more anecdotal and what I've gained from perspectives of some Latin American colleagues, is this idea of active travel being a choice versus the privilege of being able to utilize a vehicle versus having to walk to get to where you need to go to. I think that needs to be brought up because the truth is, and I'm thinking about, I'm Mexican American, thinking about my family. Like, having a vehicle is, a symbol of status, but also once you do have a vehicle, there's not a want to go back to having to take the bus and having to walk to the places you need to go to. So when that's the case, even if you live in a neighborhood where, you do have these provisions that are beneficial for physical activity, you might not want to use them. And that's, I think this is where like looking at more specific case studies would be important because I think this is also not an issue, but acculturation would be interesting to look at with this mechanism because I'd like to see with what people are doing when they're coming. So migration also would be interesting to look at. So when people are coming into the US, how do their behaviors change? Because in some Latin American countries, the environments, especially from bigger cities in Latin America, are very supportive of physical activity, and it's just a part of everyday life. But that's not necessarily the case here in the US. So a couple of thoughts on that, but that's where my mind goes.
I was thinking for the longitudinal section, I'm saying this with a big caveat that I don't know anything about the connection between anti-eviction policy and rent control and zoning laws. nor do I know about the connection between that and activity, but I do know that there's research on how, wow, that was like a crazy intro. That there's research showing that rent control and eviction protection significantly reduces like chronic disease incidence and even in the shorter term, like mortality in general, because it's like a shock. And I was just wondering if like you were thinking if it's possible when you're looking at zoning laws to also integrate that from the like anti-displacement side of things too. Again, I don't really know if they're actually like connected, and I don't really do research in the policy sphere at all, but I was just putting that into the.
Yeah, no, it's a great question, and some of the provisions in the zoning ordinances do get at eviction ordinances and things like that. The one, and I think some folks may be aware of this, but gentrification and displacement are hard things to study because they're hard things to measure.
Yeah.
And then if you start going into the weeds, what type of gentrification? There's physical gentrification, there's social, there's cultural. And what to me really matters is what the community members themselves are experiencing. So that's why some of my work is more high level using nationally representative data sets, but I always like to go back to those settings, and that's what hopefully I'll knock on wood with this because it's not official, but when I get this funding for the system science project, that's the goal, is to look at some of these issues.
Cool.
Just because you're talking about kind of your training in implementation science and keep bringing up kind of how important the implementation processes are, how do you think your work fits within kind of like implementation science literature and scope, or how are you kind of, how do you think your work could kind of like change some of the theories and things within implementation science?
Yeah, and I don't know if you saw, there's a good paper that came out in the past half year on health equity and implementation science, led by Dr. Rouse Brownson, my PhD mentor, and it sort of gets at that and how I want to sort of see myself in this space. And you know, it's funny because I think the implication is, well, it just depends. And this is, I think, with all like public health and methods, I don't consider myself a methodologist. I think I try to use the tool that I think is right for the moment, but it just sort of depends. And one of the reasons why I want to use system science is because it's a good way to understand that context and still get at implementation science. Actually, system science methods are now becoming an important component of implementation science. And that's my goal, is to expand on that. So that's how I at least want to start navigating that space. Moving forward, I'm still unsure, but yeah, that was a great question. If you haven't, I can try to send that application to you.
Really great job, really great to listen to all the work you do. And I had a lot of different questions, but I'll follow up with like some of the measures questions. I know you didn't have as much time to go through that.
Yeah.
But this might be a more future related question and reflects actually what you mentioned about kind of the context of like Scarborough and Chapel Hill and active transportation, right? To a workplace. For future work, I think, I'm not sure if there are any measures that look at how people, not just how people get to work, but the routes they take. So it's being about like network mapping, in terms of there are communities that, or individuals that may actually not try to go through certain communities because of high levels of surveillance, right?
Yeah.
So one consideration, remember, when I moved back down to North Carolina, thinking about Chapel Hill and Scarborough, who actually gets to be on the sidewalks and like during the day? Take a look. So people think that it's really easy to navigate Chapel Hill and Scarborough, but there's like networks within there where individuals. So I'm thinking about maybe undocumented individuals who may not want to walk down Franklin Street. Black population, there's a black population in Chapel Hill, but it's like it's really hard to tell depending on where you are.
Yeah.
In this town. And so where do people feel like they can actually navigate? And that changes the time it takes to get to work. So think about time. There's a lot of papers recently on time as a social determinant of health, which impacts Black people and people of color. Everything is taking longer because things that you think of as like a privilege to get from point A to point B, you are taking point D to get back to point B. Like it's taking them a lot of time. So I'm not sure if there's current measures or maybe a future implication for your future work of how you actually capture what people, the decision-making of how to get from, for active travel, for workplace or school, et cetera.
Yeah, and that's a great question. Definitely one of the limitations of looking at the data this way. And I think that's why, like, you know, it comes back to like, well, what are the communities that you're actually trying to work with and hopefully benefit from whatever strategy implementation you're doing when it comes to public health. But there are ways to get at that. Time use surveys, ecological momentary assessments, things of that nature, and that really has to be more case study. You're actually doing the study that Still Hope is getting funded. They told me it was, but I haven't gotten the final okay yet. But like, I'm actually going to look at differences between Chapel Hill and Durham. So some of
Yeah.
so yeah, I'm hoping to get at sort of a lot of things you talked about.
Can I ask a really basic question? So where do these zoning changes come from? Are they sort of public health people? Are they city officials? I mean, who's coming up with these? Just sort of where, I don't know anything about this. So.
They're definitely not public health people. It's a local government, and you know, planning commissions are often involved. But the truth is, it differs because this is like governed by not only each state, but each municipality, city, county can do it a different way. But I think the thing that you need to also take away is like changes don't occur that often, and it actually changes occur very often. But it's usually around language and changing of language over time. It's not these big changings, these big differences that I'm talking about with, you know, the actual provisions that could be beneficial for physical activity. So that's why we chose to only look at it over 10 years, because the truth is, even at 10 years, there probably might not be a big difference. But yeah, not public health people, not a lot of folks in the room. It's the local policymakers that are implementing these. And usually without having, I think, I guess we're on YouTube. There are questions to that. I think a lot, especially when we're thinking about equity, a lot more voices could be in the room.
And they're not designed for public health or improving physical
No.
well-being, right?
It's just to give direction or guidance to how a space can be used.
This isn't Durham County, but have you collaborated or looked into the Orange County Affordable Housing Coalition? I think they did a lot of work with the Carborough Green Space Drama recently. And then I know that for sure in the past they've had huge sway because they're policymakers and like local government folks in the coalition about like mixed land use and stuff.
Yeah, so I am aware of them. I haven't had a chance to try to partner, at least get some input into the work I do. As that's still, to be honest, just getting up and running. So a lot of the work I presented on is pre-UNC, and that's why like I wasn't able to show any local examples, but the goal is, you know, pretty soon to establish those connections. Obviously, that's an important partner to have.
I think it'd be cool because you're right, they don't really have public health folks even.
Yeah.
They're located within this huge like public health and university related hub.
Yeah. Good thought. Appreciate it.
I was wondering about with the like zoning code changes, if you looked at regions and like how, if there was any like difference in where that was happening in the US.
Yeah, so we, regional was actually a control in this, and I didn't present anything on that because that wasn't, for this specific presentation, it was what I wanted to highlight, but we are seeing that different regions are actually more likely to get zoning code reform. And I don't want to say it off the top of my head correctly. But I think there were differences between Northeast, Western as a group, and then the South was where I want to say the region that was less likely to get these ordinances or these changes occur. And then though it was a smaller sample, we did actually look at differences between urban and rural. And I mean, yeah, there's significant difference there as well.
It's kind of a half-formed thought, but like, I think the current average distance of commutes in the US, especially when you're looking at like travel to work, it's like more than 20 miles or so, which in many cases also given that how municipalities in the US work, most people don't live in the municipality that they work in. Like, for example, look at Chapel Hill, like 40,000 people commute into Chapel Hill on Carborough, or is it just Chapel Hill? I think just Chapel Hill every day. And like about 14,000, I think, work outside of Chapel Hill. And they're not subject to the same municipal services boundary. They're not served by the same transit system. And they're also not zoned the same way, especially if they're already outside of the municipality boundaries, right? And I know you're looking at mostly, I think you're looking at like the largest metropolitan areas in the US, but I'm wondering how you kind of like account for the fact that these boundaries are very arbitrary and people cross them. And also have to travel very far to get to their jobs.
Yeah, I think you pointed out a great limitation of the data.
Didn't mean that I.
No, it's true. And the actual, so we wanted to get at overall active travel and active living. The truth is that this was one of the best ways to get at that with this level data set. So this is from the American Community Survey. They have numbers of active travel to work specifically, and not overall active travel for different purposes. So then itself is a limitation, but the other fact that you brought up is we don't live our lives in our home neighborhood. There are other things of our daily living activities that we need to do, and work happens to be one of the big things that we look at, but that on average doesn't happen to be in the municipality, whatever neighborhood level geography you're looking at, it doesn't happen to be within that boundary a lot of the time. Which is why I think it's important to, obviously this higher level understanding is vital, I think, and it gives us a better understanding of what's going on and what's a potential strategy. But the more local community-based engaged work, I think one of the reasons why it's important is what you brought up, is those contextual understandings. Well, we don't actually live our whole lives in this bubble that this data is representing. It's outside of that as well. So I think that's a good point.
But I mean, it says a lot that even with this limitation, your data still shows significant results.
Thank you all. Appreciate it.
Thank you.